Just welcome everybody. Very nice to see known faces and also people from outside. So welcome everybody. There's going to be a recording, so I think we can kickstart now. Beth, over to you.
Great. Thank you, Eduard. Thank you. So I would just like to offer a welcome to this seminar to all of our colleagues. Good morning, good afternoon, good evening. What we're going to hear about today and have an opportunity to reflect and discuss is an impact feasibility assessment that was conducted on programming in mental health and psychosocial support. We're being joined here today by two consultants who conducted this work on our behalf of the Office of Evaluation, and that is Yasemin Kisbu and Manasi Sharma. They'll be sharing results with you in just a moment. I'm joined today by my colleagues who have also worked on this activity on behalf of the Office of Evaluation, Eduard Bonet and Zlata Bruckauf. So with that brief introduction, I think what I'd like to do is to hand it over to Zlata, who will begin to lead us through some of the material. Thank you very much for joining.
Hello, colleagues, and thank you so much for joining. So this work has been a collaboration between the impact evaluation team and the global thematic team. So big thank you to Beth, to Eduard, who were leading and supporting that. Just I wanted to kind of frame it a little bit. About 3.5 years ago, we started working on impact feasibility assessment. And the reason for that, the driver was to understand how we can work on impact evaluation, on outcome level measurement at the global institutional level. And for that, we developed a methodology that Yasemin and Mansu will talk you through. But it was the second IFA that we did. And just to see why this was important, and it is still important, maybe more than ever. We say there are three imperative of three rationales for impact evaluation today. The moral imperative is simply that the most vulnerable children and families deserve the best, the most scientifically grounded evidence for decisions that are made for them and on their behalf. The second argument is political. So today we have the political argument is probably as strong as ever. There is a growing skepticism in the world about the foreign aid. And there are questions why we spend all this money abroad. So the donors and their domestic voters, domestic donors demand rigorous evidence to demonstrate results, to demonstrate that actually money spent deliver results and deliver outcomes and impacts. And finally, there is a financial necessity. Again, at the time of dwindling resources and for aid and increased competition for these resources, impact evaluation can bring tangible return on investment. Because we know we have quite a few examples when our decisions made by governments on coverage, on scale up of successful program can bring lasting benefits to many more children and families. Next slide, please. So the overarching objectives of the impact feasibility assessment was to identify opportunities, but also limitations for implementing rigorous impact evaluations of some innovative, scalable programs in MHPSS field. The second objective was to propose methodological approaches and program adaptations for robust and coherent impact evaluation designs across multiple countries. So as I said, the whole idea was how we look at this from the global perspective. And finally, as we at the Evaluation Office are very closely linked to the global thematic evaluations. The idea was to see how this work can inform the global thematic evaluations and also global program task force that are working at NHQ. With that, over to Manasi and Yasemin. Thank you so much.
Thanks so much, Zlata. So I can briefly introduce myself, and I'll also turn over to Yasemin to introduce herself before we go into the slides. So as I think someone's mic is on.
Could someone please mute their mic? Thank you.
Okay, so if you can see me and hear me. I know there were some questions in the chat about the slides being seen by everyone, so just making sure that people can see the slides as well. Please let us know in the chat if there are no issues. Okay, looks like it's all fine. So as we'd mentioned, I'm Manasi. I'm working at the Harvard School of Public Health as research faculty, and I'm an epidemiologist by training with a background in mental health. I also work at UNICEF as the mental health technical expert, and I've been working across the Office of Research, EPRO, and UNICEF Office of Evaluation on various projects on mental health and psychosocial support programming. And really glad to see many colleagues here who I worked with across UNICEF as well. Yasemin, if you'd like to introduce yourself before I go into the slide.
Sure. Thanks, Manasi. Hello, everybody. This is Yasemin Kisbu. I'm an evaluation consultant for the HQ Evaluation Office, working with Zlata and colleagues, and working for the ICF Impact Evaluation portfolio specifically. I'm also an associate professor of evaluation research methods based in Istanbul, Turkey. Thanks. Over to you, Manasi.
Great. So as others have mentioned already, we did this impact feasibility assessment exercise. And just to stress that this was a demonstration exercise to identify promising interventions that can be used as case studies for impact evaluations. We did this in 2023 and 2024. This was done in a very systematic way across 4 stages. At the first stage, we did a rapid review and stock-taking exercise on what works. I'll go into the details of this specific stage as well, but we looked at the UNICEF documents and guidelines and existing evidence on mental health and psychosocial support programming to really identify which interventions work and where the evidence gaps are. This then guided our stage 2, which was the longest stage in a way, because we did a lot of consultative interviews with many people who are on this call. So we did a mapping and selection of the most innovative, transformative, and scalable interventions. We did this across 21 countries, and we'll go into the criteria around interventions were selected, how the mapping was done, and also how country offices and regional offices and headquarters were consulted across these processes. We then moved on to stage 3, where we shortlisted from this entire scope of interventions that we had identified. So we shortlisted 4 selected interventions and additional promising interventions as well that we could use as case studies for impact evaluations. And this was again done in consultation with the country offices and the regional offices to identify and propose feasible options for impact evaluations. And then based on this, we did our stage 4, which was recommendations and the summary of this entire process, but also recommendations on how to do these impact evaluations and how to integrate them within MHPSS programming across UNICEF. Next slide, please. So I now talk about stage 1. I'll be talking about stage 1 and stage 2, and Yasemin will be going over stage 3 and 4 before we turn back to the evaluation team. So in stage 1, we did the review and stock taking. This was done using various information sources. We used the MHPSS global framework, which many of you would know about. This was conducted by Program Division. It's a very extensive document. And when you see the links to the reports that we have, you'll see the details of this document as well. It's the operational framework that UNICEF has been using for MHPSS programming, detailing the terms of reference for this programming and the theory of change. There are 4 key outcomes that they looked at, but we have focused on outcomes 1 and 2. So child and adolescent mental health specific outcomes and caregiver specific outcomes as well. And Yasemin has shared the link to these reports in the chat as well, if you'd like to look at it alongside. Apart from the UNICEF MHPSS global framework, we also looked at global evidence. So I was heavily involved with and led the evidence and gap map exercise that was done by the UNICEF Office of Research. If someone is able to share the link to that in the chat as well, otherwise I can share it after I present, which was an extensive exercise where we condensed evidence from more than 70,000 studies down to 700 studies that were published in the last decade. And these looked at the evidence on what works across all child and adolescent mental health conditions, outcomes, domains, and age groups. So it's a really extensive piece of evidence, and we use this alongside other key evidence gaps that we identified in what works across promotion, prevention, and treatment interventions for children and adolescents. And then we also use the MHPSS evaluative baseline document, which was developed by the Office of Evaluation across 19 selected countries from all the different regions. And this has been critical in feeding into the MHPSS programming for the strategic program cycle, the previous one. And now we're using this exercise to feed into the next one. Next slide, please. So part of this was also consulting, as you saw, with the headquarters, but also various program offices. And we identified some key opportunities, so high gain areas that were based on the evidence gaps from the extensive exercise that was done for the rapid review and stock taking. There were strategic areas, including which interventions fit into the next strategic plan, which interventions are feasible in terms of their ability to be feasible, being scalable. So if they can be delivered, for example, by non-clinicians in any way, if they can be scaled up and generalizable, which interventions are multi-sectoral, which is a hallmark of UNICEF programming for MHPSS, and which interventions can also be innovative and combine elements from different sectors, but different components as well. We also looked at geographic gaps. So we identified that there were a lot of evidence gaps on what works from Sub-Saharan Africa, but also Eastern Europe and Central Asia. There were also gaps in interventions in humanitarian settings, specifically around disasters and epidemics, including for COVID-19 and other pandemics. We also identified areas that have a high burden of mental health issues, but relatively less resources to deliver interventions, and countries from the evaluation baseline that I mentioned previously. There were also programming areas that we identified as high gain. These were digital interventions, as we're seeing there's more priority being given to digital interventions, and this came up especially during COVID-19. There are outcomes that have less evidence, but might be risk factors for mental health conditions. So outcomes related to behaviors, early childhood development outcomes, social emotional learning. Similarly, interventions in early middle childhood. These are age groups that have less evidence on what works, especially the middle childhood, where we know that a lot of mental health conditions develop by the age of 14. So we identified this as an area for high gain. And then finally, although there are many caregiving and family-based interventions, there was an evidence gap around this. So we decided to focus on at least one caregiving and family-based intervention, especially given UNICEF's focus on this in the MHPSS program. Next slide, please. So at the stage 2, we did a mapping and selection of interventions, and we used these criteria in determining how the mapping was done. So we looked at political interest and will. To also identify these criteria, we spoke to all the selected country offices. We had extensive interviews, and we also had extensive interviews with each of the regional office MHPSS focal points and HQ focal points as well. We had a strict scoring criteria. So if you look at the detailed report, you'll see how countries were scored on these various criteria. And we looked at low, medium, and high priority countries and contexts. So we looked at political interest and will, which was the government and the local actors' willingness to understand what works and to implement interventions for MHPSS. We also looked at operational facilities, so whether there was facilities at the national level, at the local level, for data, for research, for evaluation, including both primary and secondary data sources. We also looked at evidence gaps at the country level. Some of this I've talked about in the previous slides as well, what we identified at stage 1. And then we looked at evaluation capacity. We also had some proxy measures. We had suicide, where we had cross-country data on suicide levels as a mental health burden outcome. And we looked at disruption due to COVID-19 using a metric, again, which is shared in the report as well. Next slide, please. So I'm moving fairly quickly through all of this, given the time, because we also want to leave some time for discussion. But we really focused on interventions that would allow us to see what the impact of the program was and use an evaluation design that allows us to build a counterfactual and have a comparison group to see causal effects as well. We identified the potential of the intervention to have an impact and how innovative and scalable it was as well. We looked at the maturity and the timing of the intervention, its potential for scale up. And then we also looked at the high gain areas that we had identified at stage 1, including geographic relevance, digital interventions, whether they've been done in humanitarian contexts, the age groups that were being addressed, and then interventions targeting the outcomes related to caregivers and teachers. Next slide, please. So I'd like to spend a minute focusing on this slide because we really now jump into the interventions. So you'll see that these were the countries that were identified as, and these were selected based on the various criteria that I've just mentioned. We identified high priority countries based on the previous factors, medium and low priority. This by no means is an indication of whether we wanted to work in any of these countries or whether work can be done. This is just for the demonstration exercise. We identified, so you'll see in green are the interventions that we have selected as the demonstration cases. And then we also identified in yellow highlight other promising interventions that we could also have impact evaluations around. So we had Pode Falar in Brazil, which is a digital intervention, mobile CFS in child-friendly services in Benin, Magnificent Me, which is the comic book-based intervention in Nepal, and the P4CD or Parenting for Child Development intervention in Papua New Guinea. And then on the right side, you'll see the outcomes from the MHPSS global framework. Just to quickly mention outcomes that are in green. So 1 is related to the child and adolescent mental health. And then 2 is related to the caregiver and teacher mental health. 1.1 was related to services, 1.2 was related to environment and support systems, and 1.3 was related to skills development. Similarly for caregivers as well, services, support systems, and skills development. More details are available in subsequent slides. Next, please. Okay, so we'll go into these selected interventions now, including the impact evaluation designs. But just to reiterate, these were the 4 ones that we've selected for detailed demonstration exercises on how rigorous impact evaluation can be done. These were selected because they address the different high gain areas and the evidence gaps that we have already talked about. So we had mobile child-friendly services in Benin, which was identified also as an area in West Africa where there's lots of evidence gaps from. It's an area with humanitarian context. And this is a child-friendly service that combines different sectors and provides rationale for how multi-sectoral collaboration can be done for MHPSS programming, addressing anxiety, depression, PTSD. Then we had, and this is a community level intervention, which Yasemin will talk more about the type of intervention platform. We have a school level intervention, which was Magnificent Me. It's a comic book based series. It's an innovative intervention that helps build life skills and connections for children and adolescents. This was done for 2 separate adolescent age groups, also allowing us to look at age-specific intervention material, and it was done to increase adolescents' mental health awareness and skill set. This was done in Nepal and was identified as a school-based promising intervention. And then we had P4CD in Papua New Guinea, which really addressed caregivers, mental health, and relations with children, including their parenting practices, which was an evidence gap that we identified. This is an individual level intervention, but also allowed us to look at outcomes of interpersonal violence, of domestic violence, of child rearing, and positive parenting. And then finally, we had a digital intervention. We had a lot of promising digital interventions that we were looking at as well, and it's a high impact area. So we identified Pode Falar in Brazil, which is a chatbot-based intervention for adolescents to increase their access to mental health support, awareness, and also referral with existing systems within Brazil's national infrastructure. Next slide, please. I think we turn over to Yasemin next. Thanks.
Thank you, Manasi. As Manasi mentioned during this 3rd stage of the impact evaluation feasibility exercise, the objectives were to assess the 4 selected interventions and formulate detailed evaluation plans. And these proposed evaluation designs aim to serve as rigorous impact evaluation demonstration cases across interventions implemented at different levels. Thus, we selected interventions including 1 community level intervention, 1 school level intervention, and 2 individual level interventions, for which one being a digital intervention. And also, as Manasi just highlighted, these selected demonstration cases include interventions targeting a variety of MHPSS outcomes, including anxiety and depression, adolescents' life skills, and interpartner violence affected outcomes, and also adolescent capacity for self-care and positive habits uptake, for instance. Next slide, please. For each of these interventions, we have drafted rigorous impact evaluation designs. Evaluation designs were suggested based on control group, comparison group options involving randomization, in other words, the experimental methodology, or so-called randomized controlled trials, RCTs, or quasi-experimental designs. While only one of the interventions, the parenting one, had a detailed theory of change, the information about the rationale, components, and pathways of change for the other 3 interventions was obtained through interviews with the program implementers and the programmatic staff at the country offices, and expected mechanisms of change were mapped, drawing from similar studies and linking them to intervention goals. The preferred impact evaluation designs are cluster-level RCTs in Nepal, PNG, and Benin. At the school level, at the church zone level for PNG intervention, and at the village level for the intervention in Benin. And the preferred design is a digital RCT. That means an online RCT with online data collection and online randomization at the individual level in Brazil. We have also proposed secondary options, secondary designs. These were all quasi-experimental, specifically match differences for Nepal, PNG, and Benin, while we suggested a potential multi-armed RCT in Brazil with multiple intervention arms. We would like to emphasize, though, that RCTs are preferred over the quasi-experimental designs, whenever feasible, of course, as they provide more solid causal evidence and they are more cost-effective as they require lower sample size as compared to quasi-experimental designs and thus a lower study budget. And we have also incorporated qualitative data collection and made the designs mixed methods to gain further insights into the mechanisms of impact, explaining how the intervention works or why it doesn't work. The aim is to answer formative evaluation questions pertaining to implementation, fidelity, effectiveness, efficiency, and relevance, as we are also currently doing with other thematic portfolios under the ICF, such as the child marriage portfolio, where we are having this mixed methods qualitative components to make the studies mixed methods and to also answer formative evaluation questions. These qualitative evaluation components mostly include key informant interviews with the program implementers and focus group discussions with beneficiaries. Next slide, please. For these 4 demonstration cases, you can see the reports in the shared link. For each of them, there's a separate report, an evaluation design. And we have used this template where we have included the motivation and intervention description for each of them, and then the impact pathways and the key outcomes that we have identified for these interventions, the evaluation questions, including both the impact evaluation and process evaluation questions, the evaluation designs with the several options, key outcome indicators, the timeline for data collection, the data collection methods suggested, and the analysis methods. We have also included a rough estimate in USD for the data collection costs for both the quantitative surveys and the qualitative components as well. So these are the some diagrams from one of these reports, PODEFALAR, the digital solution. So, for example, for this digital intervention, we have provided the option 1, a digital RCT at the individual level as the main suggested design, but we have also included an option 2 and option 3, where the option 2 is a multi-arm digital RCT, and an option 3 is basically a so-called dynamic RCT in which participants can be assigned to different modules in a multi-stage procedure of intervention implementation and evaluation design. Next slide, please. And at the last stage 4 of the impact evaluation feasibility assessment, we developed several recommendations relevant to future impact evaluations of MHPSS programs. And so we have addressed considerations relevant to MHPSS programming at UNICEF and considerations relevant to the impact evaluation feasibility for these interventions. So due to time limitations, I will be quickly addressing those. So first of all, of course, it's important to ensure having a clear and comprehensive theory of change for the intervention to be evaluated, potentially be evaluated, and using clearly defined MHPSS outcomes outcomes of interest, build localized measurement tools, and address key measurement issues for these outcomes is key. Planning the appropriate timeline for data collection following the expected realization of change for the targeted outcomes of interest is important. For instance, for the outcomes for a parenting intervention, while parental knowledge of child development can be expected to change shortly after the intervention sessions are delivered, the targeted parenting behaviors and violence against children are outcomes or impacts that require a change in attitudes, behaviors, and social norms, which may take a longer time to change. Also, it's important to take into account age considerations. For MHPSS programming, it is critical to refer to the stages of child development and incorporate age considerations during the planning, design, analysis, and evaluation of the intervention. Building multi-sectoral coordination is important. Multi-sectoral programs actively engage communities, schools, families, service providers, and young people themselves, and work across sectors within UNICEF. And as such, this can be utilized if they meet the criteria for impact evaluation feasibility. Thus, impact evaluations can help build systems and processes for multi-sectoral coordination as well. And finally, integration of key learnings from the proposed impact evaluations with the MHPSS global framework is highly recommended. Next slide, please. So with regard to the considerations for impact evaluation feasibility, our first recommendation is ensuring the necessary conditions for a successful impact evaluation. And here we highlight securing the essential prerequisite for a successful impact evaluation, which involves two primary aspects. The first one is to have a successful impact evaluation. We need to ensure fidelity to the intervention implementation protocol throughout the impact evaluation. And the second one is about gaining support and commitment from all key stakeholders, because this is as compared to other types of evaluation, this is a longer and effortful process. And secondly, maintaining fidelity to the intervention protocol by the implementing partners during the impact evaluation is crucial, as any deviations from this protocol raise questions about the validity and credibility of the obtained impact evaluation findings for the targeted intervention. So the assessment of implementation fidelity should be incorporated into the feasibility evaluation of the impact assessment as well. And for example, if an MHPSS intervention is being delivered in a volatile setting, such as a war-affected zone, and the implementation strategy is being adjusted spontaneously to meet the evolving needs, a true evaluation of the key components of the intervention and the potential for keeping them unchanged, it needs to be conducted. Additionally, it's important to note that if there's a specific interest in testing various versions of the intervention implementation, this can also be integrated into the design of the impact evaluation. This is possible as well. Another recommendation is to successfully implement a good quality impact evaluation. It's important to ensure stakeholder engagement and political buy-in early on in the planning and implementation process. By ensuring complete buy-in with the national and local stakeholders, intervention can be set up for scale-up and sustainability, as well as greater acceptability from the local community. And this is especially important considering that many country offices have funding and annual planning cycles, as well as local partners and governments that they have their own expectations. Building demand for rigorous evidence on impact evaluations of interventions can facilitate the scale-up activities. So another one is to incorporate process evaluation and qualitative methods into an impact evaluation. So key elements of operational learning from intervention implementation are an important evidence gap in the MHPSS literature. Therefore, we recommend all impact evaluations to include elements of process evaluation, exploring process-related aspects of the implementation, including adaptation, fidelity, acceptability, participant responsiveness, relevance, and operational synergies between implementation components. And also considering prior evidence on the targeted interventions effectiveness, as impact evaluations are often resource intensive. It is advisable to allocate such resources for interventions for which we had some initial evidence indicating that they are promising in creating change. And we also strongly recommend building country office level capacity for impact evaluations and building partnerships with key stakeholders and clearly define their roles and responsibilities in impact evaluations. Moreover, the shortlisted interventions are mostly happening in fragile and humanitarian contexts, which require innovative approaches that could help to measure outcomes and impacts under those conditions. For instance, piloting new scales and ways of measurement to assess various MHPSS outcomes adapted to this specific context and groups will enhance the monitoring and evaluation of future programs. And another necessity is to be aware of is to ensure that the program timeline is aligned with the planned impact evaluation. For example, for most rigorous impact evaluations, we collect data at baseline. That means just before the implementation starts. So the implementation timeline for the program phase, which will include the impact evaluation study, should follow that. And finally, the cost implications of planned evaluations should be taken into account, as rigorous large-scale impact evaluations commonly involve multiple phases of data collection over 1 or 2 years sometimes, and thus can be expensive in terms of resources. From that perspective, again, investing in rigorous impact evaluations for interventions that reach a certain level of maturity and preferably has some preliminary monitoring or pilot evaluation evidence of effectiveness would be recommended. Next slide, please.
I think we can stop here, Yasemin, because this is just to wrap up the next one. So thank you very, very much, Yasemin and Manasi, for an extraordinarily detailed and very well structured presentation. So thanks. I would like to give the remaining time as much as possible for questions, consultations to you. So please, to all the participants, the floor is open for anybody who wants to ask a question. You can type the questions here in the chat box or feel free to unmute and please come in. If there is nobody coming in, as I can see it, okay, we have somebody coming because I had one question following your presentation, but please.
There's a question in the chat as well.
Yeah, Tatiana, please.
Thank you, colleagues. Hello, my name is Tatiana Fedorenko. I'm from Ukraine, UNICEF Ukraine. I have a question related to the evaluation itself and whether it was possible to evaluate the sustainability of MHPSS intervention in each country. Just to understand, if there wasn't buy-in from the government level, or all these interventions were mostly through implementing partners, and how much these interventions were sustainable. Thank you.
Thank you, Diana. Just let's pick another question from Bojana. Bojana Jeftovic, please, over to you.
Thank you so much. Thank you for a really great presentation and an important topic. We are right now in some of the process of supporting the multi-sectorial government platform to develop and as well to implement MHPSS plan. They are signed, 6 ministries signed the memorandum of cooperation and developed the plan of activity. So the next step for us is to help them to secure implementation. So my main question is the whole program will be followed with maybe some kind of tool or some kind of support for us to monitor and evaluate this policy implementation from the government, to help them to, on a quality way, to monitor and evaluate policy implementation. Thank you.
Thank you, Bojana. So Yasemin, Mansi, if you want to take up the first question, this also last question and comment, and there is another question in the chat box. I don't know if you saw it from Angelica Fleischer. Basically, she's Angelica is asking if considering the risk of flow implementation fidelity in humanitarian contexts and the other challenges that you already mentioned, if you could share any more specific insights into impact evaluation design options in this type of context, in particular humanitarian.
Maybe I can take the first question and the third one. For the sustainability of the outcomes and impacts, what we do is we prefer to do longer follow-ups, a second follow-up or a third follow-up maybe, to see if the impacts are persisting over time. Of course, that requires a larger effort in terms of the timeline and also a larger budget for the study. Of course, for the sustainability of the funding, and so we still rely on the KAIs with the stakeholders, the governmental stakeholders especially. For the question on chat with regard to Angelica's question on considering the risk of low implementation fidelity in humanitarian context, what would we suggest? So we had actually recently in the evaluation office a couple of impact evaluations for interventions in the humanitarian context. And there we have followed quasi-experimental designs using secondary data. So we relied on, so not to spend the resources as this is kind of risky with regard to the implementation fidelity. We relied on the available secondary data. Of course, this first requires a technical feasibility assessment where we evaluate whether the data can, follows the timeline of the intervention, for example, such that we can connect the intervention outcomes to the outcomes as measured in this available secondary data set. So this is the I think the recommended practice for such cases, quasi-experimental designs with secondary data especially. Manasi, would you like to add something, or otherwise I can give the floor to Eduard?
So just adding on the question for sustainability, because this is definitely something that we also considered in the prioritization exercise around factors like political interest and will, national infrastructure, so things that would actually help with sustaining interventions. And as Yasemin mentioned, making sure there is also engagement with local actors, local organizations will help in ensuring sustainability. The timeline of data collection, we gave an example, I think it was the P4CD, the Parenting for Child Development Intervention, where we talk about how if there are changes to things like behaviors and social norms and mental health outcomes, that to see it over time, we can add additional time points of assessment over the long term to have more sustainability. But then this brings it back to the chat question on evaluation in humanitarian contexts, where you might have populations on the move, where we have to adapt some of these designs to have maybe assessments that are being done more in the short term. And there are issues of sustainability that come up out there. But as Yasemin described, there are some ways of getting around that as well. And I know Eduard will talk a little bit about multi-sectorality. It's something that we also discussed quite a bit, if I remember, during this exercise, because it's often challenging to do impact evaluation and isolate effects of multi-sectoral evaluations, but something that we also tried to emphasize how to do that. But yeah, I'll turn over to you, Eduard.
Thanks, thanks both. Let me comment on what Bojana just suggested, the question she dropped. I just want to insist that, so basically Bojana's point, and we were clarifying now bilaterally, was about the availability, the existence of tools that support the implementation of impact evaluations of ongoing interventions or interventions in the pipeline on MHPSS. I would like to insist on the nature of this exercise of the impact feasibility assessment and the product. So basically there are different needs or opportunities generated with this exercise. But what you have now available in the chat box, you have the links to the reports, is the impact evaluation designs of these 4 types of interventions that Yasemin commented on. That there are different types of interventions in relation to MHPSS, depending on the nature or the entry point of the intervention, if it's a school or if it's the individual directly or if it's the community level. Whether what the interventions try to change is directly improve the well-being of adolescents, children, or parents, caregivers. The repertoire of intervention selected, these 4, tries to be varied. No? So because then the next step, the idea is that the production of these impact evaluation designs are not only useful for these particular interventions that were selected and analyzed in depth, but they can be generalized, they can be adapted for any other intervention that you have, because the structure of each one of these impact evaluation design documents, which is the stage 3 reports that we call here, no, in the IFA, they are adaptable. So we hope that they are easily adaptable. But you can always ping us in the evaluation office or the evaluation focal points that you have at regional level, and for support, for consultation. There is an impact evaluation portfolio also in the evaluation office to provide support in developing capacities and standardization. So yeah, we hope that these tools are going to be useful for this precisely for this purpose, not to adapt to your type of interventions, to select which ones are more suitable and similar to the 4 ones that we have selected here in this exercise. I hope this, Boyana, is answering your comment, your question.
Yes, thank you.
Okay, okay. I know, Felicity, was there a question here? So Felicity would like to know findings from impact evaluations of these selected interventions. Sorry if I missed it, as I was a bit late to join, and sorry if it's a silly question, but I'm wondering about any plans to conduct these recommended evaluations and when we could learn about the findings. I think I can take this myself, if you don't mind, Yasemin and Manasi, for the sake of time. So there are no, in the nature of the exercise of the impact feasibility assessment, there was not the intention to conduct these impact evaluations, because this is an initiative that corresponds to the program leads, no, to decide whether the conditions, also financial conditions to conduct these impact evaluations are there, and also the investment in terms of time and effort. The exercise was trying to assess systematically what are the opportunities, what are the needs to improve the availability, if you want, of interventions and MHPSS across the organization. How can program leads improve the availability of those interventions for impact evaluation, and also generate very specific opportunities to trigger these impact evaluations, provided that there is the motivation and the moment is propitious, no? Because that's why there were these 4 ideal type of interventions for which there are impact evaluation designs. This idea, this model of the impact feasibility assessment, as Zlata mentioned at the beginning, was initially developed almost 3 years ago for the global program to end child marriage. In that occasion, the impact evaluation design documents were produced as here in this case. And they were used, most of those impact evaluation designs, they were used to apply for support through the Impact Catalyst Fund that the Evaluation Office initiated also at that time in parallel. And they used that to apply for the Impact Catalyst Fund to get support on a matching basis, financial and technical support, to conduct impact evaluations of several of those impact evaluation designs. Well, actually all of them but one. But that might be the case here or not. It depends. Or this might trigger some impact evaluations of other interventions similar to these ones or not. No? So basically there is an intrinsic intent also of generating demand, apart from assessing systematically the opportunities to conduct impact evaluations across the organization. I hope I'm answering, Felicity.
Yes, thank you. Thanks a lot, Edward.
Do we have any other hands raised? Okay, so we have adding to this, do we have any publications for Magnificent May and Friends specifically, or any publications upcoming anytime soon? I don't know. I don't know if you can answer this, Yasemin, Manasi.
There are some current documents for the Magnificent May and Friends across, because it's implemented in multiple countries, but like short documents about the intervention and so on. And there is this impact evaluation proposal in the link we have shared. And other than that, I'm not knowledgeable in any future documents.
Thanks, thanks, Yasemin.
I can take the question about the measurement tools, if that's helpful. So it's something that we have in one of our recommendations as well. The question is around the use of standardized measurement tools versus culturally adapted. This is a big area of my research as well, is the local and cultural adaptation of tools. It's something that UNICEF has been doing. So you'll see MMAP, which is measurement of mental health in adolescents. And it's a tool that was developed by UNICEF and is being integrated into MIX as well. And it's being culturally adapted across different contexts. So this is one example of how UNICEF has done this. But I know as part of some of these interventions, they've also been adapting tools within their context. This can be done through various methods, including free listing, cognitive interviewing. So happy to chat about some of these methods. But in general, we've also recommended that measurement should be adapted to the local context alongside the use of standardized tools. So identifying local items as well that work using qualitative measures. Yes, and I think Malvika has shared MMAP in the chat as well that people can look at. Yeah.
To just add what Manasi just stated about, for example, the new mental health module of MIX, the MMAPP for adolescents. Mental health, for example, we have included that for an impact evaluation of child marriage prevention program in Ghana under the Impact Catalyst Fund. And we did some focus group discussions to see to which extent the local adaptations are necessary. So the work is also contributing to measurement tool development. The impact evaluation work is contributing to the measurement tool development work as well, as you see. Mm-hmm.
And just to address Amber's question, which is around how our selected interventions align with the global evidence base. So this was part of our rapid review and stock taking exercise where we looked at the evidence gap map. I can say from personally being involved in the evidence gap map exercise, it was really aligned with the global evidence around what works and what doesn't work, was done in a very systematic manner as well. But what we also did in our initial exercise outside of the evidence and gap map was identifying other areas from systematic reviews. So we looked at systematic reviews that were done and meta-analyses that were done after 2021 to address any gaps that we might have missed over the last few years as well. So we really tried to align with the global evidence broader than UNICEF as well in what works and what doesn't work.
And thanks, Mansi. If I can just add Aladdin and others here, I will share from the MIX team. I will share the guidance for cultural adaptation, for contextual adaptation of the MIX survey module on MHPSS that the MIX team developed together with the MMAPP team for the last round of the MIX survey. And I think finally, Felicity, yes, if you want to come in, Felicity, I can just read this.
Oh, sure. I hope you can hear me okay. It was just to Wajiha's question about Magnificent May. We did collate findings from the pilot implementation of the Helping Adolescents Thrive materials across a few sites. It's nothing like an impact evaluation or anything, but we will have a report that can be shared. It'll be ready soon. So if the easiest thing might be for people to email me, and I can then email it once it's ready.
Fantastic. Thanks, Felicity.
It's a bit more qualitative though than sorry. Yeah.
Perfect. I don't know if Manasi, Yasemin, you want to delve a little bit more on Amber Peterman just put this question on asking about some of the big questions and evidence gaps beyond UNICEF. No, if you could talk about the alignment of these interventions to the global evidence-based frontier.
So I think that's what I was talking about.
Yeah, I know this was sort of answered. I guess my question wasn't so well stated. I was just sort of curious about if there's like really exciting, like new things that these evaluations will be able to tell us that like haven't been answered before. But maybe that's a broader or question that requires more sort of reflection. I don't know. And I see Zlata also has her hand up.
Zlata, please.
Well, I saw one comment from, I think it was from Alimata in the chat about that they start new programming in Mauritania. And I felt like to say, maybe make a call for all practitioners who joined this webinar and to encourage colleagues to think about impact evaluation or rigorous evidence from the very, very start of our program design. It's really, even at the time when you start putting a proposal together, because the point is that we think about theory of change, we think about outcomes we want to measure, we think about different alternative design, program design options. And at the same time, we design the evaluation. So I think this is a journey together, and I think it's really great when we get involved, not at the end when the program needs a summative evaluation, but really at from the very, very start. Yes. We certainly would love to do those impact evaluations. Funding, of course, is the key constraint. So basically, I would encourage to all new programming to stay in touch and to let us know if you are doing anything interesting that we can support you with.
Thanks, Zlata. And I think we are now on time. I will hand it over back to Beth. So to close and wrap up, Beth, over to you.
Great. Thank you very much, Edward. And thank you, colleagues, for joining and engaging in this discussion, asking questions. I think we're really looking to build upon this. So as Zlata has just said, if you feel that you can use assistance or support, as she says, trying to integrate some of the precursors for impact evaluation early into your program design, please do reach out. There is a team there to support you. So with that, I would just like to say thank you all very much for joining us this morning and look forward to further engagement. Thank you very much. Have a great day. Bye-bye.